Well, we're talking about one of the most controversial and popular surgeries today, the Brazilian butt lift. Now, we did our homework thoroughly and concluded that Marlene needed a biopsy as well as a CAT scan. So we sent her to meet with plastic surgeon Dr. Aboolian, who also examined her. Take a look.
Hi.
Hi.
Dr. Aboolian.
Morning.
So I understand you had some procedures done.
I got black market butt injections.
Marlene's condition is kind of common. We see that a lot. It's mostly done in the hotel room, places that there's no doctor. Do you know what was injected?
No.
What we're gonna do with her is we're gonna try to get a biopsy to see if we can extract some of the stuff that was in there. Disinfect the area, clean it up, and I'll make an incision, extract whatever's in there. You're gonna feel a little bit of cold, a little prick. I'm gonna do a little cut with a knife. You shouldn't feel anything. I'm trying to extract, squeeze out some of the stuff that's been injected in you.
Okay, please welcome Dr. Aboolian, who has teamed up with Marlene to figure out what's going on. So thank you for being here. It's good to see you. Tell us what you found out.
We found silicone in there. I was lucky to find a little pocket where I was able to make an incision and squeeze some of that silicone out. And I brought some of it with me. It's stuff like that. And that's why when you go in there, you can't take all of this stuff out because it just extravasates into the tissue. And if you're gonna have to take it out, you're gonna have to take out normal tissue with it.
And Dr. Phil, the statistics that you quoted are correct. That it became the most dangerous procedure that we were doing as plastic surgeons, and that the mortality rate, 1 out of 3,000, extremely high. What that did, that encouraged our society, American Society of Plastic Surgeons, to study why this was happening. We found it's all related to fat being injected too deeply. So the whole protocol now for doing a Brazilian butt lift has changed, that we have to inject superficially only, and that being said, nothing is completely safe. It is much, much safer. So the numbers you quoted, we're working to make this a safer operation with where we put that fat.
Mm-hmm.
Dangerous and deadly butt procedures.
What happened when you got to the hospital?
They said, ma'am, your daughter has passed away.
This was not an act of God. She was murdered.
And black market injections.
After these injections, she was leaking oil, pus.
I want to ask Dr. Phil what is in my butt.
I'm trying to extract the stuff that's been injected in you.
Tell us what you found out.
All new Dr. Phil.